Violence, physical, psychological, and even sexualized, still occurs behind the closed doors of psychiatric hospitals. Patients who have experienced this find it difficult to defend their rights, as their words are often devalued by their diagnoses. We've collected stories of people who encountered cruelty from medical staff during treatment. In psychiatry, results can only be achieved with a magic kick in the pants. I've been receiving care in psychiatric hospitals since 2016. I didn't immediately learn my exact diagnosis. My first day was at the Moscow Psychiatric Research Institute, where I was being treated for depression. The ward was clean, the doctors were polite, and they didn't yell at anyone. I had only positive impressions of that place. In 2017, I was transferred to another psychiatric hospital because the treatment prescribed at the Research Institute wasn't improving my condition. The situation there was worse, but it still couldn't be called critical. I was diagnosed with schizotypal disorder at a regional hospital in the Moscow region. At 16, I arrived there to treatment in the women's adolescent ward. The first thing that surprised me was the strict, almost prison-like regime. In the morning, we woke up at 6:30 a.m. Then we were led into a cramped, stuffy room where we sat until breakfast. There weren't enough benches for everyone. Because of the medication, many of the girls fell asleep on the floor. After breakfast, a woman came in with whom we studied our homework. She was very strict with us. If someone said they had a headache or were feeling sleepy, the teacher would scold us harshly and yell at us to study no matter how ill we felt. Next came nap time, followed by afternoon snacks, during which we were usually fed rotten apples. After eating, we'd return to the unpleasant, empty room and sit there, doing nothing. We were allowed to read, but not all the girls had books with them. Sometimes the medical staff would suggest watching TV, but on the day of my arrival, a doctor came into the ward, pointed at one of the girls, and said she'd done something wrong. As a result, we were all deprived of our only entertainment for 2 weeks. We'd fall asleep somewhere between 8 and 9:30 p.m. I remember instances of physical abuse. The nurses would sometimes hit and violently push my roommate. The girl couldn't speak properly. All she did was fidget, which apparently irritated the staff. I don't have many memories of that hospital because for almost 2 months, I was given strong pills and slept most of the time. The last medical facility where I was treated was in the village of Mednoye Vlasovo. In the first few days after arriving, I thought the place was generally decent compared to my previous hospital. I was assigned to the adult ward where patients had more independence. We were allowed to leave our rooms as we pleased and sleep as much as we wanted. Only after a while did I begin to notice oddities. For example, we were given cigarettes 3 times a day after meals, which was sorely needed for smokers. Extra cigarettes could be earned by mopping floors or cleaning. Of course, we agreed to these conditions voluntarily, but we really had no choice. One day, a woman who chirped like a bird was brought into the ward. She was given clothes, but she started tearing them up and throwing them in the trash. After she ruined several t-shirts, a nurse came up and hit her in the face so hard that her nose started bleeding. Incidentally, the woman with the bird-like voice had been hit more than once. Another time, a nurse swung at her for something she'd done wrong. The patient became frightened and fell to the floor, prompting a hospital staff member to kick her in the back several times. Violence was also used against another patient I shared with her in the ward. She was brought in drunk. Upon arrival, she began to complain about the staff's actions. Then another patient, also being treated for alcoholism and well-liked by the orderlies, approached and hit the new patient with all her might, which left a bruise on her face. The patient, who was friendly with the staff, was downright brazen. She yelled at me and other people in the ward for no apparent reason and used physical force. Several girls and women, including myself, wrote a letter to the head doctor asking him to deal with the instigator. In response to our appeal, the head doctor merely laughed and told us not to bother him with such trivial matters. At some point, I told my mother about the violence at the hospital. She came and spoke with the head nurse. After their conversation, a nurse rushed into my room and started screaming, "Did I specifically hit you? Did anyone ever lay a hand on you?" I was hysterical and couldn't calm down for a long time. I was called to see the head nurse. She gave me a sedative and began explaining that in psychiatry, results can only be achieved with a magic kick in the pants. She said that patients can't control themselves, so peaceful means are impossible. To confirm my disability, there's no need to be committed to a mental hospital once a year. After everything I've seen, I'm scared, of course. I'm afraid of facing violence again. I doubt they'll beat me. In all the hospitals I've been in, they only raise their hands against patients with serious diagnoses, for whom there was no one to stand up for them. But watching beatings is stressful for anyone.